Hello and welcome to Pregnancy Info. Today we will discuss about postpartum bleeding or the bleeding after delivery of your newborn. It may be one of the few things you haven't discussed with friends. Here's an honest, clear account of what you can expect with bleeding after birth. Every woman bleeds after they give birth. You will have vaginal bleeding after you have given birth. This bleeding is known as Lochia. This lochia is a combination of mucus, tissue, and blood that your womb sheds as it replaces its lining after you have given birth. Bleeding after birth may last for a while. Bleeding typically lasts around for 24 to 36 days. If your lochia lasts longer than 6 weeks, don't worry, that's normal too. Bleeding will start off heavy and red to browny red. It will become lighter in color and flow over time. Here is what you can expect. Day 1. Fresh red to brownish red blood, heavy flow that probably soaks one maternity pad every few hours, with 1 or 2 clots or several smaller ones. Day 2 to 6. Darker brownish or pinkish red blood, moderate flow with 7 cm to 12 cm stains on your maternity pads and smaller blood clots. Day 7 to 10. Darker brown or pinkish red blood becoming lighter, variable but lighter flow with less than a 7 cm stain on your pads. Day 11 to 14. Darker blood or pinkish red blood becoming lighter flow. You may have some sanitary towels that are hardly stained. Week 3 to 4. Paler, possibly a creamy white blood loss. Flow is very lighter than previous flow. Week 5 to 6. Brown, pinkish red or creamy yellow stains, possibly for several weeks and possibly only on some days. Don't keep quiet about clots. They are common. Discuss any clots with your midwife as she will want to keep track of what's happening. Save your maternity pads to show your midwife if possible. Passing a lot of large clots can flag up something more serious. If you pass a lot of large blood clots or more than a pint of blood in the first 24 hours, seek treatment. Passing lots of large blood clots or more than a pint of blood in the first 24 hours after birth are symptoms of primary postpartum hemorrhage. 5 in 100 women will have primary postpartum hemorrhage after they give birth. Several postnatal blood loss can make you feel even more exhausted than in normal given birth after giving birth, but it can also be life-threatening. Getting quick treatment is essential before it becomes a major hemorrhage. Treatment normally involves helping your uterus to contract through massage, an injection, or a catheter into your bladder. The doctors will check to make sure all of the placenta has come out and may have to do this under general anesthetic. You will also have a drip in your arm and blood taken for test. The risk factors of primary postpartum hemorrhage. Before labor, risk factors are previous postpartum hemorrhages. It means if you have a history of hemorrhage before, so you may also have this time. A body mass index mean BMI above 35. It means you are if overweight. A twin or triplet pregnancy. If you carry more than one fetus or baby, then it can also be the cause. Low-lying placenta or placenta previa is also the cause. Placenta coming away early or a placenta abruption. Preeclampsia or high blood pressure is also the cause. Anemia may also lead to hemorrhage. Growth in or around the womb. This is called abnormal growth. Taking blood thinning medications. If you are taking such kind of medicine, that it can lead to hemorrhage. Blood clotting problems. If you have had any blood clotting problem, then you may also suffer from this. Think about postpartum bleeding when you pack your hospital bag. Pack maternity pads rather than sanitary towels, as they will allow the area between the vagina and anus to heal with the least irritation. Describing the number of maternity pads you are using also gives your midwife a clear picture of how much blood loss you are experiencing. Lots of things can affect the amount of blood loss. Breastfeeding is one of them. Breastfeeding makes your body release oxytocin. This makes your womb contract and produce more and redder Lochia blood. Any sort of gentle exercise Even a quick wake-up of the launch could also make bleeding heavier. This is especially true in the first 2 weeks. Bleeding will tend to be heavier in the morning too. This is because blood pools when you lay down sleeping. It is important to keep an eye on your blood loss in the weeks after giving birth. It's possible to get secondary postpartum hemorrhage, which is abnormal or heavy bleeding between 24 hours and 12 weeks after giving birth. It is usually caused by an infection. Symptoms include pain in your pelvic or lower abdomen that are not after pains, feeling shaky, feverish, and generally ill, having lochia with an offensive smell, heavier than expected bleeding or bleeding that becomes heavier rather than lighter over time. If you have any of these symptoms, you should speak to your GP or health visitor. It's important to reduce your risk of infection. Wash your hands thoroughly before and after using the toilet and changing your maternity pads. Avoid touching your stitches or any wound dressings. You should also remove your jewelry and watch before washing your hands and keep your nails short. Always speak to your GP or health visitor if anything doesn't feel right. If you have any worries about your bleeding after you have given birth, talk to your health professional. They will help you in this respect. There are some suggestions that I want to give you in this respect. Use warm bottle to heat your belly to reduce the chance of clotting. Also use hot water to drink. Don't drink cold water, that it will be the source of making clots and it can produce pain in your pelvic area or in your abdomen. Another suggestion is that you can use Postpartum for reducing the blood strains. If it's available in your pharmacy or your doctor advises you to take this medicine, it can also reduce the bleeding. So you can use Postpartum 3 times a day. Hope I have discussed all about the bleeding and its problems and its amount. So if you like the video, then like it, share it, and also subscribe my channel to encourage me. Thank you.